Are you taking medication for high blood pressure? Maybe you have wondered if it could be causing erectile dysfunction or ED. It is a common worry. Many men feel nervous about their blood pressure pills and how they might affect sexual health. This concern adds extra stress on top of managing heart health. For a long time, the link between blood pressure meds and ED was pretty fuzzy. Old ideas suggested some drugs might mess with blood flow or nerve signals. We heard things about certain beta blockers or diuretics, but honestly, we did not have strong proof. This left patients feeling confused. Doctors were not always sure what to tell them either. It made it hard for people to stick with their vital treatments. We really needed clearer answers. Some earlier studies hinted at a link. Others found nothing definite. This just added to the confusion. Even professional groups like the American Heart Association say some drugs might cause ED, but others do not even mention it. That kind of mixed message can make you hesitate about your treatment. Do not you deserve clear, reliable information about your health, especially when it touches on quality of life and sexual well-being? So, to clear up this widespread uncertainty, a big new study was launched. This investigation really dug into the connection between blood pressure meds and ED. They designed it to avoid the problems of older research. Those studies often looked at too few people or did not focus enough on ED itself. The researchers used a huge real-world database, the FDA's Adverse Event Reporting System, or FAERS. Think of it as a giant collection of patient experiences after drugs are on the market. It captures what happens when millions of people actually take these medicines. This real-world evidence is amazing for spotting side effects that might not show up in smaller, controlled trials. By looking at all this data, they could see patterns of ED across all kinds of patients. They got a big picture that smaller studies could not provide. They analyzed data from 2013 to 2020. That means millions of prescriptions for many different blood pressure drugs. This massive analysis let them see ED rates for different drug classes and even for individual drugs within those classes. They covered a wide range of common medications like ACE inhibitors, benazepril, lisinopril, RBs, losartan, valsartan, calcium channel blockers, amlodipine, diltiazem, beta blockers, metoprolol, carvedilol, thiazide diuretics, hydrochlorothiazide, and many more. This thorough look made sure almost every common blood pressure drug was included. The method was simple. They compared how many ED reports there were to how many patients took each drug. This gave them a standardized rate per 100,000 patients. It is a very powerful number, showing what is really happening out there. So, what did they find in this huge study? The results were really eye-opening. The overall reported rate of ED linked to blood pressure medications was surprisingly low. Over 8 years, the total was just 0.12 reports per 100,000 patients. That is a tiny number. It should make you feel much better. For most people taking these important medications, ED is simply not a common side effect. This extremely low rate suggests that your blood pressure medicine is probably not the main reason if you are experiencing ED. This finding challenges a lot of old ideas and beliefs about a widespread link. The study's conclusions are strong, based on over 879 million prescriptions. That is a monumental amount of real-world patient reports. While reporting went up a little over the 8 years, the overall rate stayed very low. It seems the worry about meds causing ED might be bigger than the actual problem. Here's a particularly crucial discovery, something that really changes how we think about these drugs and side effects. The study found no big difference in ED rates between entire classes of blood pressure medications. This is huge. It means we cannot just assume if one drug in a group causes ED, all drugs in that group do. This study disproved that old generalization. Instead, they found clear, meaningful differences among individual medications. Even drugs in the same class acted differently. This is a game changer for your care. For example, only 2 specific drugs, ramipril and bisoprolol, showed a statistically higher reported ED rate. Ramipril had 1.4 reports per 100,000 patients, and bisoprolol had 3.4 reports. These were the only drugs above 1 reported event per 100,000 prescriptions. So, while the overall risk is still very low, these specific drugs might carry a slightly higher risk. But get this, within the same class as ramipril, ACE inhibitors, drugs like lisinopril and benazepril had some of the lowest ED rates. Lisinopril was at an incredibly low 0.04 reports, and benazepril at 0.019 reports per 100,000 patients. Furosemide, a diuretic, had an astonishing 0.008 events. Diltiazem, a calcium channel blocker, was at 0.022 events. Even hydrochlorothiazide, a very common diuretic, had a very low rate of 0.05 reports. This specific detailed finding means doctors and patients should not just assume a class effect for ED. What happens with one specific drug is not necessarily true for others, even if they are similar. This helps doctors fine-tune your treatment. This difference between individual drugs gives doctors and patients much better, more personalized choices for treating high blood pressure. Older research often said diuretics, like thiazides, and beta blockers caused more ED, while ARBs were safer. Many of those older ideas came from smaller studies, where ED was not the main thing they were looking at. This new, large, real-world data now corrects those old, sometimes misleading, assumptions. The findings clearly show that the link between high blood pressure, its treatment, and ED is much more complex than simple drug class ideas. The study confirms that general class effects for ED are often wrong and too simplistic. It stresses the need to look at each specific medication carefully. This evidence-based insight empowers you and your doctor. It means if you are experiencing ED while on blood pressure therapy, there's a good chance the ED is either not related to your medication or that another drug, possibly even in the same class or a different one, could control your blood pressure with a much lower reported risk of sexual side effects. This clearer understanding helps you have better, more informed talks with your doctor. It leads to better health outcomes and a better quality of life. Like any scientific study, this one has limits. It used self-reported data, so researchers could not control everything. Things like your age, other health problems, exact drug doses, or how severe the ED was could not be fully tracked. Also, people volunteered to report side effects, so some might report more, some might report less. But it is still incredibly valuable. This patient-generated real-world data gives us a unique view, filling in gaps that controlled trials might miss. Despite these limitations, the sheer scale of the data, millions of prescriptions over 8 years, makes its conclusions very strong and clinically important. So, what is the most important takeaway for you and your doctor from this big study? The overall reported rate of ED directly linked to blood pressure medications is remarkably low. This should bring a lot of peace of mind. It strongly suggests that if you are taking medicine for high blood pressure and also experiencing ED, it is highly likely your life-saving blood pressure medication is not the main cause. This key evidence-based knowledge should ease your worry and anxiety. It lets you approach managing both conditions with more confidence. Now listen, this part is super important. You should never stop taking your blood pressure medication without talking to your doctor first. High blood pressure is a serious long-term condition. You need to manage it constantly to avoid severe heart and other health problems. But if you are experiencing ED and you are concerned about your blood pressure regimen, this groundbreaking research offers a clear, evidence-based path forward. You now have solid scientific information to discuss your concerns openly and confidently with your doctor. It is okay to ask about the specific medication you are on and its individual ED profile. Based on this new understanding, your doctor might consider changing your treatment plan. They could suggest other drugs that have shown a lower reported incidence of ED, even if those alternatives are in the same pharmacological class as your current prescription. This very individualized, data-driven approach is key to getting the best results. It improves how well you stick to your treatment and significantly boosts both your heart health and your quality of life. The finding that ED impact varies by individual drug, not by broad drug class, gives doctors much more flexibility, precision, and insight when choosing your medication. This empowers both you and your trusted healthcare provider to make truly informed decisions that carefully balance crucial heart health with essential sexual well-being. If you are dealing with high blood pressure and worried about ED, do not hesitate. Talk to your doctor. They can review your current medications, discuss suitable alternatives if needed, and explore all possible factors contributing to your symptoms. Your health, peace of mind, and overall quality of life are paramount. Take this informed step towards feeling your best. This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. Get on-demand, concierge-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations associated with traditional medical visits. Take control of your health anytime, anywhere. Visit globalmenswellness.com to start your free trial today.